Hey everybody, Dan here with Pain Free You. Today's topic is going to be the presence of pain does not mean damage. So let's take a couple of nice deep breaths. I'll let you take a look at the lake. Breathe in the peace. Exhale the stress. Breathe in the calm. Exhale the hectic. Alright, so kayak's under a tarp right now. We got a little rain coming in soon, so I don't want it to fill with water. Alright, so the presence of pain does not mean damage, or it's not proof of damage, right? And I get it, when you hurt bad, when you hurt a lot, when you hurt often, and when you move and you hurt more, it's common sense to go, there's something wrong. There's really something wrong. Bunch of ducks making noise. So it's very easy to conclude that there's something wrong. There's something really wrong when you hurt so bad. And I talk to people all the time who are hurting so badly they can't sit, they can't walk, they can't do anything. But again, what I'm really sharing with them is that the presence of pain is not evidence of damage or the extent of damage, right? You can have pain with zero damage. You can also have damage without pain. And so it's really important to understand that in the TMS world, the presence of pain means danger, not damage. The severity of the pain is really determined based on how vigilant, how on high alert the brain is, how much danger the brain is perceiving. So for somebody who says, oh, every time I take a walk, my pain flares, that's just the brain saying, well, you've been telling me for years you got a bad hip, or you got a bad back, or you got sciatic nerve problems. So every time you try to walk, it's going to go, stop it, turn up the pain. And so I will encourage you to just go back to fundamentals, go back to the assessments, right? The pain test, the ppdassociation.org/symptoms. There's an assessment there. Go to painforyou.com. There's a downloadable assessment which will help you connect the dots and really try to get a good handle on the fact that this is nothing more than neural circuits firing in the brain as a result of perceived danger, right? So the severity is based on the severity of the danger that's being perceived. The duration is just however long you stay in that fear mode, which is why it's really important. I talk about it all the time. The two things that are the fuel for persistent symptoms are fear and attention. But if I told you, ignore it, don't pay attention to it, it's impossible. Why? Because you can't ignore something you're terrified of. So I just really want to remind you folks that TMS, the core message of Dr. Sarno that I am carrying forward, is the core message is you're not broken. There is no damage. Even if they find something on an x-ray, or even if the doctor says, it might be this, it might be that, that's not proof. The presence of pain does not mean that the doctor's accurate in their assumption. And ask some pointed questions. Hey doc, what degree of certainty is your diagnosis? Is this just what you are thinking? Or do we have evidence? Where's the proof? Right? Show me the proof. And if they kind of hem and haw a little bit, or say, well, based on your symptoms, this is what we've figured out in the past. That's not a diagnosis. That's their best guess based on symptom descriptions from you, which is also subjective. So they're interpreting subjectively your subjective description of symptoms and trying to come up with a diagnosis. And even those structural things that are seen on MRIs, X-rays, CAT scans, ultrasounds, that's still not definitive, because the vast majority of people have abnormalities on MRIs. You know, Schubner put together a video that says all MRIs are normal. Search for it on YouTube. Dr. Schubner, all MRIs are normal. He's basically saying that if you do MRIs on, 100 people 60 years and up, you're going to find abnormalities on the vast majority of them. Things like arthritis, degenerative disc disease, osteoarthritis. These things are common. When you're 80 years old, like almost everybody has it. It's called aging. So look, the fact that you hurt doesn't mean you're broken physically. And then once you learn about TMS and this mind-body syndrome, the presence of pain does not mean you're broken mentally or emotionally. Like I said in the video the other day, it's just where you ended up. Your nervous system, your brain is responding to perceived danger. And if your pain's really bad and you've been freaking out about it for a long time, all you're doing is confirming the brain's belief that that there's danger going on. And so if you keep on freaking out and keep on saying it must be physical, it hurts so bad, it's got to be physical, how can it not be physical? Well, you're just confirming the danger. And what do you think the brain's going to do when you keep on reminding it that I'm in danger? It's going to keep the pain going. So your number one job is to really calm down. You're not broken. And if you could really understand that and get that deeply and breathe that in, it's easier to calm down. Because when you realize you're truly not broken, it's so much easier to settle yourself down. So, the presence of pain does not mean damage. It does not prove damage. The severity of the pain does not prove anything. It just is direct correlation to the brain's perception of danger. The more danger, the more severe the pain. So, please take this in. That's what's going on. I like this shirt. WTF. Where's the fish? The fish are all out there. So, that's all I got for you. The presence of pain does not prove anything. And do the assessments. What you're going to find is that the behavior of the pain, when it came on, whether there was a true injury or anything, if the pain's lasted longer than normal healing time, if there was an injury or surgery, it's learned pain, it's TMS. The brain has memorized those pain signals and keeps them going based on the freak out level, the danger level. So, if you got a lot of pain, it doesn't mean anything other than the brain's perceiving danger. It's your job to teach it that you're not in danger, that your body's fine, your emotions are fine, that stress is fine, that visiting your mother-in-law or your father-in-law or your sisters or your cousins who usually piss you off and send you into a pain spike, none of that is dangerous. Teach your brain that none of these things that typically trigger a flare-up, basically teach your brain that none of those things are dangerous. Yeah, they can stress you out, but they don't need to cause pain. That's the issue. So many people say, I can't get rid of my family. I can't get rid of the people who stress me out, so I'm going to be in pain forever. Not really. You can just change your response to those stressors. You can change your response, frankly, to those people, right? So, anyway, if you're telling yourself you're stuck and you'll never get better, be careful. Those are instructions to your brain. Tell yourself that you can get better, that you're on the right track, that you're learning, you're making subtle little changes every day, you're taking baby steps, you're on this road to recovery. And if you'd really like the fast track to a road to recovery, go to painforyou.com and look for the menu at the top that says course and coaching. And there's the details on my group coaching program. Kicked it off 1st of June 2021, and so far it's going great. Anyway, I'm going to wrap this up. Love you guys and gals. The presence of pain doesn't mean anything. So don't assume it does. It just means TMS. Love you. See you tomorrow.